My name is Dr. Jeremy London. I'm a board-certified cardiovascular surgeon. I've been in clinical practice for the last 25 years. Today, we're going to talk about the 4 most common risk factors that patients have that end up on my operating room table for heart surgery. Now, specifically, this is bypass surgery. In other words, it's surgery for blockages in the heart artery. So what we're doing is we're reestablishing flow to areas of the heart muscle that are blood starved. As you might expect, this might be the same set of risk factors that is common for patients that are undergoing stenting, where the artery is actually opened from the inside with a metal stent, again, to reestablish flow. The difference is that the stents are done by cardiologists. I am a cardiac surgeon, so we do this operation through an incision either in the middle of the breastbone or one just off to the side, and then take tubes from other locations in the body, like arteries that live behind the breastbone, arteries in the wrist, and veins from the leg to basically redo the plumbing of the heart to reestablish blood flow to areas of the heart that are blood starved. So what we're reviewing today is risk factors that are common to a vast majority of these patients that end up on my operating table. Now, this is my experience over the last 25 years. It's very much in line, I think, with the experience both across the country and worldwide. But I want to make it clear that this is not heart surgery in general. This is specific to bypass surgery, which again is blockages in the arteries that can cause heart attacks, which create the situation that heart disease is the #1 killer of both men and women worldwide, claiming approximately 19 million lives a year. We want to take a minute and thank our sponsor of this podcast, LMNT. Hydration isn't just about drinking more water. It's about replacing what you lose. When you sweat from workouts, sauna sessions, or just daily life activities, you're not just losing water, you're losing electrolytes like sodium, potassium, and magnesium. That's why I choose LMNT as my electrolyte replacement of choice. LMNT has everything you need and nothing you don't. Their electrolyte formula uses a science-backed electrolyte ratio of sodium, potassium, and magnesium. Electrolytes are used by every cell in your body, and even minimal dehydration can limit cognitive and physical performance. LMNT tastes great and helps me replenish my electrolytes after a hard workout or sauna. I mix 1 packet of LMNT, usually my favorite flavor, grapefruit salt, in 32 ounces of water to ensure I stay hydrated throughout the day. If you want to try LMNT for yourself, head to drinklmnt.com/London and you will receive a free sample pack of all 8 of their most popular flavors with any purchase. That's drinklmnt.com/London. Plus, they offer an unlimited time, no questions asked refund policy. So if you buy it, try it, and don't like it for any reason, they will refund you. Now let's get back to the podcast. So let's review the risk factors, but first let's start with what a risk factor is. As the name suggests, having these characteristics or these behaviors or these qualities increase the risk of something occurring. So what we're going to review today is things, the 4 most common things that increase the risk of you developing blockages in the heart arteries themselves that could cause you to end up on my operating room table. The first one, I don't think is going to be a big surprise to many of you, is smoking. Hands down, smoking is without a doubt one of the single worst things that you can do for your body. It affects so many different organ systems. It affects the heart by creating blockages in the heart arteries and potentially increasing your risk of heart attack. It affects the brain because you can get calcium formation in the carotid arteries, which is the arteries that supply the blood to the brain, and pieces of plaque that then form in that artery can break off and cause a stroke. In addition, it causes lung cancer. We know this from many, many years of data. Cigarette smoking has been around for quite some time. Vaping, I know, is always a question when we bring this up. We don't have the years of data associated with vaping, but the same trends are occurring with vaping as they do with cigarette smoking. Now, what is your increased risk if you are a smoker? If you are a light to moderate and somewhat regular smoker, it's at least a 2x, 2 times risk when compared to someone that doesn't smoke. If you are a heavy smoker or a long-time smoker, that risk could go up significantly. Now, what do cigarettes do to the arteries themselves? Well, there's several mechanisms at play here. The first is that there are a lot of what we refer to as toxic metabolites or toxic chemicals, if you will, that are brought into the body through the lungs that then get washed into our circulation. These directly damage the lining of the arterial wall. In other words, the inside lining of the artery, whether it's the artery to the heart, whether it's the artery to the brain, arteries to the legs, it can directly damage that arterial wall. And it's the repair process then that causes blockages in these arteries. There is a significant inflammatory reaction in the body as a result of cigarette smoking. This then accelerates this damage process at the arterial wall that then accelerates the entire process of plaque or blockage formation. Finally is the direct effect of nicotine on the arteries themselves. Nicotine is a vasoconstrictor, which means it tightens down the arteries. Two things happen with this that can be very negative. The first is that if you're narrowing these arteries as that injury repair process goes on and blockages occur, well, as you tighten those arteries, it can actually cause those arteries to spasm and close prematurely, which again can cause problems like heart attack and stroke. In addition, as the arteries become stiffer over time, this increases your risk of developing long-standing high blood pressure. Now, look, I understand that cigarettes and tobacco use is incredibly addictive, and I'm not going to soapbox you, just like I don't soapbox my patients in the office. But it's really important to me that you understand that by smoking, you are increasing your risk and exponentially increasing the rate that you can develop blockages in multiple arteries throughout the body, and specifically arteries in the heart, increasing your risk of heart attack. Once you understand what the risks of cigarette smoking are, my hope is that you can decide between the years that it's time to make an effort to quit smoking. And once you do that, the various supplements like Nicorette gums or nicotine patches or therapy or some medications may in fact be helpful. But until you make that leap, until you decide that you want to quit, those things will not make you quit. They'll help you along the way and assist you in that process. Because what you need to understand is that if you're trying to prevent ever ending up on the operating room table, you want to control the things you can possibly control. So making an effort in this way to quit smoking on the front side prevents you from ever getting there. If in fact you're told that you need an operation, it's really, really important that you work hard to quit smoking. Why is that? If we're going to together decide that we want to accept the upfront risk of going to the operating room to do bypass surgery, to continue to smoke after that operation has been done, all bets are off, because not only does cigarette smoking affect the native arteries, the arteries within the heart, but it also accelerates the hardening of the process within the bypass grafts, so they just don't last as long. So the idea is what we call primary prevention: quit smoking so that you don't develop the blockages. But if you do end up developing blockages, it's really important that you remove cigarette smoking from your daily routine so that you can prevent further blockages from occurring after you've accepted the risk of undergoing a procedure to get you out of trouble on the front side. The good news is that by quitting, and quitting for an extended period of time, you actually can eventually fall under what we call the same risk as a non-smoker would fall under, or close to. Now, a lot of that depends on how heavy you smoke in the first place and how long you've been smoking. But typically speaking, after 3 to 5 years, your risk drops off very close to that of a non-smoker. So making the effort is truly worthwhile. Because what happens to many people is they think, well, my gosh, I've been smoking for this long. The damage has already been done. What good does it do to quit at this point? The reality is, even quitting for a day helps some as far as lung function and things of that nature. But quitting for an extended period of time can actually shift your risk back down to the level of a non-smoker. The next risk factor, the next thing on the list that makes it more likely that you're going to end up on my operating room table with blockages in your heart arteries, is high blood pressure. And many times this is known as the silent killer, because 1 in 2 adults in the U.S. have high blood pressure, and many don't even know. Now, why is high blood pressure even dangerous? Your blood pressure is elevated. It typically is a sign that your arteries in your body are constricted or tightened. So every time the heart beats, it's seeing a lot of resistance. It's having to do more work with each heartbeat than if the blood vessels relaxed appropriately and the heart was seeing less resistance. Well, this does 2 things over time. 1, the heart's a muscle. Anytime you stress a muscle under tension, what does it do? It gets thicker and bigger, no different than your bicep or your legs when you work out. As the heart gets thicker, the heart cavity actually gets smaller, and the actual efficiency of the heartbeat can go down. In addition, this elevated blood pressure inside the arteries, much like cigarette smoking, directly injures the lining of the blood vessel itself. And again, the repair process that the vessel has to go through is where you get the formation of the plaque and consequent blockages in the arteries. So you kind of get it from 2 different directions. One is that the heart has to work harder, and over time it begins to fail, and you develop blockages in the heart arteries that are bringing oxygen and nutrients to that heart muscle that now has to work harder. So you're asking your heart to work harder with less fuel and oxygen, which then increases the risk of cardiovascular disease. The good news is that high blood pressure is the single most modifiable risk factor for heart disease that we know. What does that mean? It's easier to change than many of the other ones. So where do you start? Well, first, you want to make sure that you go to your annual physical so that your blood pressure is getting checked at least once a year by your physician and is being followed. But that is one measurement at one moment in time. It doesn't really give you a great snapshot of what your blood pressure is over an average. So what's recommended is that you do home blood pressure monitoring. You can find blood pressure cuffs on Amazon for around $20. The way that you want to take your blood pressure at home is as follows. First, you want to be very relaxed. So you want to sit quietly, typically in a seated position with your back well supported and your feet flat on the floor, not with your legs crossed. Interestingly, by simply crossing your legs, it can artificially elevate your blood pressure. So legs uncrossed, feet flat on the floor, with your arm comfortably relaxed at approximately heart level. You want to place the cuff approximately 2 centimeters just above this crease in your arm. Now, there will be an indicator on the cuff that'll say artery, or it'll have a red mark. The artery runs right along the inside of your arm, so it's in line with your fifth finger, with your pinky. So you want to line up the artery mark. It'll either say artery with an arrow, or there'll be a red mark right at that level. You want your arm relaxed, and you want the cuff to be comfortably snug where you can maybe slip a finger just underneath the cuff. You don't want it too loose, and you don't want it too tight. You then want to take your blood pressure both in the morning when you first get up and are relaxed, and a second measurement in the evening, typically before you go to sleep. Why is that? Well, there is variation in your blood pressure during the day. When you first wake up in the morning, we secrete cortisol, which is a stress-related hormone as the day gets going. So that can, in some individuals, elevate the blood pressure in the morning. But in the evenings, as you start to wind down, your blood pressure may be a little bit lower. So taking multiple blood pressures, and you can do it more during the day as well, over the course of a minimum of about 7 to 10 days, and then averaging those blood pressures gives you a much better sense of what your actual average blood pressure is than showing up in the doctor's office and having it taken one time. There is a syndrome called white coat syndrome as well, that many patients, when you walk into a physician's office, you immediately become anxious. Most people don't like going to the doctor, and blood pressure can be artificially elevated as a result of that. So by doing this at home, you avoid that entirely, and you can allow yourself to get into a situation where you're totally relaxed and you're taking it multiple times during the day over the course of 7 to 10 days, and then recording those. And that's very valuable information for your primary care physician to do that prior to you coming in, because that is some really important data that they can utilize to decide whether or not you fall into the 50% of Americans that actually have high blood pressure and they may not know it. So if you do have high blood pressure, and as I mentioned, it is the most easily modifiable, what do you do about it? Well, first, it's lifestyle modifications. Being very thoughtful about your nutritional plan, focusing on whole foods, maintaining your weight appropriately, moving every day, a solid sleep hygiene program, and trying to reduce stress to the best of your ability. By dropping 1 kilogram or 2.2 pounds, you can actually decrease your blood pressure by a full millimeter of mercury, a whole single point, by losing 1 pound. Now, clearly, you can still have high blood pressure even if your weight is well maintained. And there's certain situations where you lose weight and you're exercising regularly and you still have high blood pressure. And medications are certainly an option and potentially necessary in these situations. And understand that should you need medicines in addition to lifestyle modification, it's not a failure. In fact, that's not unusual at all that actually needs to occur. Sometimes you need medications just for a short period of time until you figure out how to dial in other lifestyle modifications. But if you need them long term to maintain a healthy blood pressure, that's how you can modify this risk, again, to avoid having to have procedures for blockages in your heart arteries. We'll get back to the podcast in a minute. We'd like to thank our sponsor, Function Health. Taking control of your health starts with understanding your biometrics. I use Function Health to tailor my nutrition and wellness plan. Function offers over 100 plus biomarkers to give you a comprehensive picture of your health at an affordable price. Their advanced testing includes 5 times the standard primary care panel, testing for biomarkers ranging from heart health, hormone status, kidney function, nutrients, and more. Not only will you see which biomarkers are in and out of range, but Function will also analyze each biomarker and offer insights from top doctors in their specialties. Clinicians will contact you promptly if any urgent results arise. Knowing your data is powerful. Function helps you navigate the information and allows you to design a biomarker-driven plan to maximize your health span and lifespan. If you are interested in getting your 100 plus biomarkers, visit www.functionhealth.com/London and you'll receive a $100 credit on your membership. That's www.functionhealth.com/London. Check it out. Now let's get back to the podcast. The third risk factor is diabetes. Now, when most people think about diabetes, you think about folks that require insulin replacement, and that is in fact a category, and they are too at an increased risk of heart attack and stroke. But the more common type of diabetes that we see is what's referred to as type 2 diabetes, which is an insulin resistance that occurs as a result typically of eating high sugar, high carbohydrate foods that you're driving a lot of glucose into your bloodstream. And over time, what happens is your body creates a resistance to the insulin that it is secreting. You continue to eat high sugar, high carbohydrates, blood sugars go up, your body secretes more and more insulin, but your body just doesn't respond to it in a standard fashion, which means you have all of this extra circulating both glucose and insulin in the body. That's why it's referred to as insulin resistance. Type 1 diabetics, the ones that require insulin, typically don't make any insulin in their bodies. These are individuals that make insulin normally but have created a situation where their bodies have become resistant to the insulin that they're secreting, and it becomes this kind of vicious cycle where you have these two things at exceedingly high or elevated levels in the bloodstream that then can increase the risk of cardiovascular disease. Well, how does this happen? Well, to keep this kind of a general explanation, it happens in 3 different buckets, if you will. The first is kind of a metabolic bucket, that it affects your entire body, your entire physiology. By having high blood glucose levels, it increases lots of different factors that then combine to increase the risk of blockages in arteries. Things like cholesterol and triglycerides, and creates organ dysfunction when it comes to clearing these things that, again, puts you at an increased risk. The next is directly in the vascular wall itself, because insulin inhibits something called nitric oxide, which is secreted normally in the vessel wall. And what this does is it allows the vessel wall to relax normally. Well, insulin can suppress the amount of nitric oxide that's being secreted at the vessel wall, which then causes these blood vessels to become stiff. As we discussed earlier, stiffer blood vessels then can result in high blood pressure. High blood pressure can then result in increased work of the heart, as well as direct damage to the blood vessel lining itself. Working in addition to that is that these increased levels of glucose and insulin drive an inflammatory response in the body, which then becomes this engine, this stoked fire, if you will, behind this injury repair process at the vessel wall itself. So there's a lot of different effects throughout the body of why high glucose and high insulin is so important to control. Now, the good news again is that with effort and engagement and modifying lifestyle, this is something that you can really work at controlling. But first, you have to know if you have it. That which is not measured cannot be improved upon, just like the blood pressure. The silent killer. Many people don't know because they just don't measure their blood pressure. Same thing with blood sugars. Now we've got lots of things at our disposal, like the continuous glucose monitors. You may have seen folks with that stuck on the side of their arm. Well, that's really useful for real-time data to identify whether your blood sugars are responding appropriately. It's normal for your blood sugars to rise after you eat a meal, but they should come back down in an appropriate period of time. And they should come back down with exercise, even simple things like going for a short walk after dinner. So it gives you some real-time data. They are not cheap, and as a result, limited to some folks, but they are useful if it's something that works for you. Your yearly annual physical is where you're going to have a standard check of a fasting blood sugar. That is very important. In addition, something called hemoglobin A1C is a marker for how well your blood glucose is controlled over time, because what this is measuring actually is the percentage of sugar or glucose that's attached to red cells. And red cells typically live anywhere from 90 to 120 days. And so it gives you a much broader snapshot of how well your blood sugars are controlled. So if in fact you do have a high hemoglobin A1C or fasting blood glucoses, as the case may be, however you determine this with your physician or on your own, what do you do about it? Well, I actually used a continuous glucose monitor, and I fell into the 80% of individuals that are pre-diabetic that don't know they are. With really intensive lifestyle modifications, I worked really hard to tighten up my diet, focused on whole foods, limited sugars, increased my aerobic exercise and training. I was already doing a fair amount of resistance training, but making those changes, in addition to working on my sleep and other things, I was able to bring my hemoglobin A1C down to the normal range. But it's really important that you know where you are if you're going to make those improvements. Now, there are some more general indicators that you may be at risk for what's referred to as this cardiometabolic syndrome, or metabolic syndrome that then can consequently affect the heart. That's what that means. And it's a real simple measurement that you can do at home. It's actually a waist to height ratio. You measure your waist, you measure your height, typically in centimeters. Then you're going to divide, and you want your waist to height ratio to be less than 0.5. Greater than or equal to 0.5 puts you at an increased risk of cardiovascular disease. Well, why is that? Well, it has been shown time and time again that visceral or abdominal fat, that pooch in the belly, if you will, is where a significant amount of the adipose tissue that drives this inflammatory response and can support this environment for insulin resistance resides. So that by losing weight, exercising regularly, changing your diet, and reducing your visceral fat, you then can move that needle. Now, clearly there are people that are insulin resistant that have a normal waist to height ratio. It's not a absolute, but it's a good place to start and a good indicator. That being said, just like high blood pressure, if you make all the lifestyle modifications and you just can't move the needle, then medications may be appropriate, and there are a wide range that can be utilized to help, again, shift you away from this risk factor for developing blockages in your coronary arteries. Something to be particularly aware of when it comes to being pre-diabetic or diabetic is that you may not feel anything. You may not have any symptoms at all. So if you don't check, you don't know. Just like myself, I had no idea. I thought I did a really good job with my diet, my exercise, and all this, but I clearly wasn't doing as good as I needed to do. So even though you're not having any symptoms doesn't mean that you don't have this problem. So that which is not measured cannot be improved upon or corrected. Please at least spot check hemoglobin A1C at your yearly visit to make certain that you don't fall into this category. The final category is one that always creates a lot of discussion and a great deal of emotion, and that is dyslipidemia or high cholesterol. Now, let me start by saying that our bodies need cholesterol, and cholesterol is good. Why is it good? Well, it actually helps form all of our cell membranes. It's what creates that outer protective layer of every cell in our body. In addition, it is the foundation for hormones and vitamin D and lots of other functions in the body when it comes to neurologic function and immune function. It is critical. There is no doubt about that. But the other thing that there is no doubt about, based on the data, is that elevated LDL-C is directly related to an increased risk of cardiovascular disease. Specifically, if you look at the ApoB or apolipoprotein B molecule, which encompasses all of what we refer to as the atherogenic or truly bad cholesterol, and that can be LDL-C, very low density VLDL, as well as what's referred to as Lp(a), which is a genetic form of abnormal atherogenic cholesterol. It encompasses all of these things. So looking at ApoB, which is a form of atherogenic cholesterol, we know that an elevated level increases your risk of cardiovascular disease. When you look at the actual plaques, at the actual blockages, you don't find blockages without cholesterol deposits. It is a causal relationship. So in spite of all of the information that you might hear on social media or in the news, it is well proven that particularly elevated levels of ApoB, lipoprotein B, is directly related to an increased risk of heart disease. As I mentioned, cholesterol is necessary, and our bodies make cholesterol to fulfill that need. If you have elevated levels, particularly of ApoB, lifestyle modifications are really important. The impact that that has on lowering your cholesterol levels is modest when compared to medications. Now, it's always a good place to start, and there's no reason not to, and to follow that appropriately. But understand that being familiar with the data and understanding your levels and having a very transparent conversation with your physician to help direct which interventions are most appropriate for you is really important. This isn't informed consent from your physician to you. This should be educated consent. These are all risk-benefit decisions. And as long as you understand what those are, what the risks of cardiovascular disease, heart attack and stroke, etc., are as a result of certain levels and what the benefits are from lowering that, and consequently what the risks are and potential side effects from medications, you can make an intelligent decision for yourself. And that's what's ultimately most important, that you're making an educated decision that works for you. But it needs to be based on the data, not on just random information that you may find on social media. Now, it's important to me that you understand that these are 4 risk factors. Now, there's always extreme examples. Whenever we talk about these kind of scenarios, there's always a discussion. Yeah, my grandfather was 85. He smoked his entire life. He ate whatever he wanted. He drank every single day, and he lived till he was 98. I don't believe any of this. And you know what? That's true. There is no doubt that there are outliers. There are extreme cases. The other one that always comes up is Willie Nelson. And I agree. Willie Nelson has preserved himself awfully well given his lifestyle, but that is the exception. It's not the rule. This is a game of probability. And so you have a choice. Do you want to tip the scales in your favor? Do you want to stack the deck so that you can potentially win the game? Or do you want to lay all of your chips on the less than 1%, the one example of, yeah, I got this friend or my grandmother or Willie Nelson? If you don't have any of these risk factors, it's no guarantee that you're not going to have heart disease, because there are other factors that are involved, like your genetics. Clearly, genetics play an important role, but these are the 4 most common when we look at patients undergoing heart surgery. So you can have none of these and still have blockages in your heart arteries. But my hope would be that if you have one or more of these risk factors, that it sets the stage for you to be proactive and not reactive once a problem has already arisen. It gives you this opportunity. It gives you this first golden ring, if you will, to actually move the needle, to decrease and modify these risk factors before there's a problem, before you have to react to it in some way, like ending up getting a stent in one of your coronary arteries or potentially ending up on my operating room table. So my goal is to shed a light in a way that you can potentially change the future headwinds of your health span, lifespan, and longevity. Thank you so much for your time today. I certainly do appreciate it. If you're watching on YouTube, you can like and subscribe. If you're listening on Spotify or Apple Podcast, you can leave up to a 5-star rating. And if you subscribe, you will get notified so you do not miss any future episodes. If you're interested in these type of topics and would like to do a deeper dive, please check out our free weekly newsletter. It looks at a lot of these topics in a much more in-depth way. You may enjoy that format. Thank you so much again for your time. I hope you guys have a great day.